Welcome, everybody, to episode 10 of the Functional Firefighter Framework podcast. Today, we have a guest in studio, Dr. Zaki with Optimize Physical Therapy. Today, we're going to be talking about movement requirements for firefighters, some common injury patterns that you've seen. You've treated how many of us so far, would you say?
As a company, probably close to 100.
Awesome.
Just from the rescue.
Okay, cool. Clink. Real quick, a little bit on your background, what Optimize specializes in and what you're currently working on.
Yeah, so I'm a doctor of physical therapy. I graduated from Turo University, Nevada in 2015. After that, did an orthopedic residency at University of Michigan, and then went over to Ohio State, became a trader, did a fellowship over there. And as soon as that was done, packed up my car, moved back to Vegas, and started up Optimize, which the vision of the company was always to change the way healthcare is delivered, mostly to the active adult and athlete. So that's who we specialize in. And as we first started, actually, one of our first ever patients was a firefighter. And from there, started developing more and more of a passion of helping people that are athletes but aren't recognized as athletes, and started realizing that they're in a position of dire need of someone that understands how they move, understands their lifestyle, still treats them like a human being and not just a body part, because the requirements, I think, both stress level wise, job requirements, physical requirements, mental requirements that firefighters go through isn't very well understood by anybody in our profession. There's not a single class in school that taught me that. There wasn't a single course that taught me that. And it was all by meeting more firefighters, learning about them, and actually, giving a shit about what they do and understanding that, they do such a big service to any city or county they're in, but they don't get treated as such. So kind of lit a fire under me. And then as our team kind of expanded and grew, we brought on other docs that have the same kind of passion. So that's what, led us to working with so many more firefighters. And now we have a program for firefighters that we can help out. And we designed this program so they all get one-on-one attention like any other professional athlete we work with. And we look at them the same way we look at it as a professional athlete. And we've been able to see some really cool results.
Awesome. Cool. And the one thing that I could say, because obviously me and Clink been going Optimize. Clink before me, was for our viewers and listeners. This isn't your standard physical therapy. This isn't something where there's this a geriatric facility where we're doing hip replacements or knee replacements, and there's jazz music playing, and there's a bunch of band workouts where you have an assistant come over, say, do 3 sets of 10, and we'll move on to the next, and they leave. Literally, people think of it, and that is not what it is. It is one-on-one attention with a doctor that is evaluating every movement. One of the things that you do that is such a small thing, but for me as a patient that I appreciated and I noticed it instantly, was you use your phone as a camera. And you go, hey, look how you're moving.
Right.
Stop that. And then we'll do something and you'll go, see how it's gotten better. And instantly, within 3 minutes, you're like, wow, that was really. So I just wanted to make sure people knew, like, oh, no, a physical therapist is, this quiet place where, no, this is, it's grueling. It hurts. It's not fun, but it's required. So
and I think that's the big thing too, is like you said, standard physical therapy, it's not your standard physical therapy. What it needs to be the standard, right? So that's the big thing that I think was one of the big visions for the company, is why isn't it the standard? Why is it so special that we care about you guys enough to give you one-on-one for an hour? Why is that special? That should be the standard healthcare does, not just in physical therapy, but when you go to see a physician. Why are you moved from a waiting room for an hour to another waiting room for an hour, and then the doc comes in for 15 minutes and tells you to eat these meds and see me in a couple of weeks? Like, why is that the standard, and why do we accept it? So those are questions that were always rattling around in my brain, and I never came up with a good answer, So that's why, we're trying to revolutionize and be very innovative in the space and change the way we deliver healthcare.
And I would say the most comforting thing about your clinic is it reminds me of football.
Yeah.
Right?
Oh yeah.
Like that was the care I received and the type of physical therapy. Like my wife can pet me at home. for an hour. You know what I mean? Like I want to get fixed.
Yeah.
You know what I'm saying? Like I want to have change, and I don't want, I like you all give like a list of workouts for the week. It's like, hey, make sure you do these things at home. It's like, so like your goal is almost counterintuitive to the business model, because you're like, I don't want to see you again. Like I want you to be well on your own. Like come in maybe monthly for a checkup, see how things are going, but I want you to solve your own problems at home, like, which is awesome for a consumer standpoint. Right?
Absolutely. And you're right. Like for the business model sake, that's why every other physical therapy clinic or chiropractic clinic, you come in and they say, hey, come in 3 times a week for, 8 weeks, or chiropractic clinics sometimes say, come in for the rest of your life. You need us. And building that dependency weakens you mentally, weakens your perception of who you actually are as a human being, because you build that dependency on someone, regardless of what it is, and you feel like you can't do it yourself. Whereas we already know that if you really want to make true change in your body, it's going to require work from yourself. No one's going to fix you. Even like the soft tissue stuff or hands-on stuff that we do, that's to, gain some temporary change to where now you can move and get that long-term change. At the end of the day, the exercise and the movements are always going to be what's going to give that long-term change. But we also know when it comes to patients, whether it's firefighters or otherwise, the best patient is the most informed patient, and they're going to make the best decisions. And sometimes you have to find, everybody has a different why. Somebody might be, they want to make sure they're alive so they can walk their daughter down the aisle in 10 years. Some people want to make sure they can keep providing for their family. Some people want to make sure they can stay in this bowling league that they get all their social, interaction from on a weekly basis. It doesn't matter to us, that what the why is. It matters that we find it and we make sure that's what we use as motivation to make sure, everything we do is to make sure that you keep this in your life, because it's important to you, not important to me, but important to the person in front of us.
Yeah. And when you mention 2 words, the standard and dependency, one of the things that you are very, very adamant about is that evaluation pre-imaging. And that seems to be standard. And then that leads into the dependency of unnecessary shots, unnecessary surgeries. Can you go in a little bit on that and why and where that belief comes from?
Yeah. So the standard model is, someone gets hurt, whether it's at work or whatever, you immediately go see, emergency room, urgent care physician. From there, they send you for x-rays. And then from there, you go to a specialist. And then from there, they send you to physical therapy. And by the time you're there, you've spent a bunch of money and you spent a bunch of time not really getting great answers, because all the research on medical imaging, whether it's an MRI or x-ray, whatever it is that a lot of those findings they find on there that are quote unquote abnormal are really just incidental findings, right? There's people out there with torn meniscus and, degenerative disc disease in their back, and they have 0 symptoms. So why, when they found those on your MRI or x-ray, have they said that's what's causing your symptoms? If they can exist without causing symptoms, then they can never be the cause of symptoms. Now, I'm not saying imaging isn't important. For certain cases, it is very important, but there's research showing timely or early MRIs, depending on how, for low back pain, when you get them, will completely change the direction of your care, right? So if you get an early MRI within, when you don't need it, it's been shown your chances for getting injection and surgery and pain pills skyrockets, even for the same grouping of symptoms, even if the same intensity of symptoms. So at the end of the day, you can both save money, not only to yourself, but to an employer or to whoever you're talking about, by seeing a physical therapist first. You can get people back to work faster. You can get them, taking healthcare back into their own hands instead of waiting for the next appointment, waiting for the next image. Oh, this image says I'm broken. Now in your mind, you're broken. And a lot of physicians are in that mindset of, not really thinking about what they're saying to patients. Like I've had patients come in and say, oh, my doctor said I have the knee of a 70-year-old. Even if you think that's true, why would you say that? It doesn't make any sense. Like, what benefit are you getting
Dependency.
from that? Exactly. So that's what we're trying to really dispel those myths, trying to push that information out, not only through social media, but through everybody we interact with, that, you are not your image and like your medical image, and you need to have a provider that cares about you enough to really, comb through this research and see, could this possibly be an incidental finding? And if it is, make sure you understand that, because words on an MRI report or a CT scan or whatever it is can be very scary to patients, especially patients that don't have a medical background. right? So you have to make sure you treat them as such, and you give them as much guidance as they need.
For sure. Yeah, and I experienced that firsthand when I had ran the marathon, woke up the next day, walking with excruciating pain on the outside of my leg. Remember? And I called you and I was like, dude, I think I have a hairline fracture in my shin.
Right.
It hurt, like not like sore. I was injured.
Yeah.
And I was like, I for sure need to go get an x-ray because this thing's broke.
Right.
And sure shit, I don't know if there was a protocol that you had followed. There were literally, it was within 5 minutes. Picked my leg up, said, do this, do that. Well, obviously this is what's going on with this nerve because you're able to jump through these hoops and meet these standards or whatever movement capabilities. This is what it is. Right. And going to you first, being able to run through those evaluations, stopped me from going to an emergency room, getting an unnecessary x-ray. So experiencing it firsthand is really eye-opening to go, oh, wow, like there's hands-on evaluations, which isn't standard. It's let's see what's going on here, send you, and then we'll get the results and go from there. So,
well, like you all like practice voodoo or something, right? Because it's always that weird, like, hey, when I got promoted, this is going to sound really weird. I think sitting in that front seat, I got lower back pain just because you sit in a weird angle. And I think when we met, it was right when I made captain.
Yeah, right after.
The first firefighter you saw was Morgan Uhas, and she introduced us, and we came in, and it wasn't very long after just sitting in that seat like that, because the front seats aren't very comfortable. Like my lower back was bothering me, and we did some breathing exercises, and I sat up, my lower back pain was gone. I'm like, well, I don't know what you just did.
With the medicine ball between the knees? Yeah, doesn't make any sense.
I don't know what you just did to me. But I feel foolish coming in here and just breathing a little differently. Now my back pain's gone. But it's stuff like I've never seen that. I never had that done. You know what I mean? So it's those kind of modalities are.
I remember when he did it the first time, and I asked him like, "Hey, like, remember we asked you, is there a little person inside?" That's like, yeah, I got it right, because you hide it well. And I'm like, this dude has to be so excited when he nails it, and it's always on point. And you're like, no, I have to hold it in, because sometimes you're like, this is gonna work, and it doesn't.
And it doesn't. And that's the big thing, is like, no matter what the profession is, the treatment or the intervention is all based on the assessment, right? So same thing, like say you had a business that wasn't as profitable as you think, and you just think, oh, maybe I just need more social media marketing, or I need to put money in here and here. Until you really dive into the details of why this is happening, it doesn't matter where you throw money. You might get lucky, but I'm not willing to chance your health on luck. I'm willing to base it off of previous patterns that I've seen, the research I've done, and everything else that I know about you guys. And it's one of those things that, it seems you have to have a poker face a little bit, because if I do something and it doesn't work, I'm like, okay, this is probably why it didn't work. Let's go to the next step. And if I put all my eggs in one basket, maybe the placebo effect that you thinking like, oh, he's so sure this is going to work, it should work. But I don't want a placebo effect giving you those changes. Maybe there is some placebo effect in everything we do, but I don't want that to be the main reason you're getting those changes, because then it's like you get them once, but what if next time you do them, you don't get their same result? So we put ourselves through the scientific process where, we have a hypothesis and we test the hypothesis, and we know that if there's extraneous variables when we do the intervention, that, maybe we're not on the right track. And I don't want the extraneous variables to be the reason the results happen. I want it to be the reason I think it's happening, because knowing the why will allow you to extrapolate that and give more, changes to this person's life for more long term, rather than just getting lucky and being, oh yeah, we'll just keep doing that. So it's a very interesting, and even other physical therapists are kind of surprised by the way we treat people, and like, looking at rib cage, pelvis, foot, looking at breathing patterns, because, I feel like, breathing it's one of the most important things in the entire body. You don't do it, you die, right? So why wouldn't the body put that at a very, very high priority, right? Breathing is an easy way to speak to the nervous system. You can hyperventilate right now and breathe yourself into anxiety, even though nothing around your environment has changed. So it's a very, very powerful tool. And when powerful tools like that happen that we can't like really physically explain, some people do run a little bit too far with it and start doing, voodoo, hokey pokey type stuff. But we want to make sure that like, everything we do is like, founded in science, and there is some kind of theory that we're testing every time, that we're holding ourselves to that standard of testing the theory. And if the theory is wrong, okay, let's make a change.
Yeah. So, and on that leads it perfect. Clint had mentioned his previous back injury. I had seen you from my knee from an injury that I'd had, an MCL injury from stepping off the rig. What are some of the, I guess, common injury patterns that you've seen with firefighters?
I would say the top three would definitely be low back, shoulder, and knee. Those are definitely the most common. Sometimes like more stress related neck and like upper trap stuff goes on, but for the most part, it's going to be knee, low back, and shoulder, which is funny because it's not completely different from the average population, right? But the reason it happens is pretty different, right? And the distribution is a tiny bit different too, where the average population is more low back. But we know with low back pain in the general population, it has more correlation to stress, depression, and other kind of mental correlations than it does with than like physical movement patterns for the average population. Now, as you get more active and have to lift more weight, have to move in different patterns, then the biomechanics of everything start to matter a little bit more. And that's why, the distribution of most common injuries, low back falls down the list a couple spaces to the shoulder and knee. So those are generally the most common areas.
Cool. We're going to break into some actual movement patterns that we perform.
Sure. Let's take a look.
Alrighty. And so for those of you listening on Spotify or Apple, you're going to have to go to YouTube because we're going to do videos of a few different things we do on the fire ground and on EMS scenes. First one is a single person 24-foot ladder throw.
So maybe describing to the listeners on Spotify what we're seeing. Seeing a firefighter carry a ladder over the right shoulder, walking with the load, walking up to where he wants to deploy the ladder, and places it down, kind of stands in like an asymmetrical lunge stance, pulls the cord to extend the ladder up to the desired height, and then going to leverage with his foot the bottom rung and applying it along the wall there.
And we throw that a little differently here. We hold it more like a shot put, essentially. Okay. So essentially the load is on the hand, and you're either grabbing a beam or a rung in front of you and throwing it up.
So seeing that as far as having that load on one side of your body, walking with it, what are parts of the body that should be strengthened to be able to eliminate anything happening or having the ability to do this effectively without injuring yourself?
Right. So the biggest thing that I would want the listeners to take away from this as we break these things down is that movement preparedness will trump movement quality. Meaning that it's more important to be prepared for the movements that you're doing rather than trying to do them perfectly. Because especially as firefighters, you live in an imperfect movement world where there's environmental factors that nobody else has to really take into account, but you guys have to, whether it's the size of the person or the staircase or the home or the building you're in, right? So being prepared for this, the things you'd have to do to be prepared for this is making sure that in your training you are carrying some kind of asymmetrical load. Now, most asymmetrical load carrying exercises generally have them like below the waist with the arms extended down by your side. But you may want to get into like a front rack position with a kettlebell and carry things like that, or like a bottoms up carry or overhead carries, and make sure you're working on positions like that. And then now, while he's extending the ladder, the most important thing is look how strong his base is, right? You need to be able to get into a lunge stance and be strong there. The leveraging that as you lay down is probably more based on technique, but I would say overall, this movement doesn't look very much different than things you can prepare for in the gym really, really easily in your program. So I think that people that aren't prepared for this movement can very easily get prepared if they do the right movements in the gym. Like I said, unilateral carries more towards the overhead side, and like getting good at lunges and static holds in the lunge position.
Awesome. Cool. Let's move on to the next one.
So this is a flat load hose deployment, and this is obviously a walkthrough. if a building's on fire, it's going to be a scotch faster.
Right. Right. So right away you see like, you're pulling off a static load off of a engine there. And the biggest thing there, and a couple of injury patterns we've seen in the past, is people trying to yank that hose off a little bit too quickly and not pre-tensioning the muscles in that area. And what happens when you get a strain physiologically, what happens is the muscle is being lengthened or shortened too quickly before it can yield to those forces, right? So example I like to use is like someone throwing an egg at you and you wanting to catch it and not break it. If you have room behind you to yield that force and absorb it, it's going to be a lot easier to not break the egg versus if you don't have the room to go that way, right? So at the end of the day, you're still receiving the same egg, but like where you're putting the force, you get a different result.
So how would you pre-tension that?
So once you get your hand or arm through the loop that you pull off, I would actually lean into it and like gradually bring on the force and then jump off with it. Instead of having the hose at slack and trying to yank into it, pretending like that's what's going to give you that force.
So you're saying maybe you step on the lip, step towards the hose load.
Yeah.
Secure it.
Mm-hmm.
And then you're saying like pre-break that load
absolutely.
A little bit. Okay.
Absolutely. Yeah, the pec muscle and the bicep should be on and should be engaged before you start applying that maximal force. On the maximal force, you could apply it the same way. But now you're taking those muscles that you're going from like a jerky, quick kind of motion where the tissues in our body, because they're made of collagen, they're made of soft tissue, generally are much more yielding when they have a tiny bit more time to kind of yield into that. And it could be like a fraction of a second. So it's not really causing you too much slowdown.
But it's the other way where I think I've seen people, I'm sure you've seen it, where they think that if they can get it, they can yank and then get it. And then even when they get the tension, they'll walk closer to it because I need to get one more good yank, and be able to get it out before they go. So they'll intentionally create slack because they think that they need that little bit to create enough force unloaded to be able to instantly jerk it off and causing that load to then I'm sure cause the injury is what you're saying there.
Yeah. And like we talked about, not all movements are inherently dangerous, right? So that in itself, grabbing it quickly off the fire engine is not an inherently dangerous movement. It's just that, when you're sleep deprived and there's, a house on fire and there's other things going on, you're not going to be paying attention to all the little things, right? So like we talked about, if your body's prepared for those things, it could probably handle them pretty well. But I think people forget to take into account the sleepless nights you guys have, the amount of smoke inhalation, all these other stressors you guys have. Those are things that are very, very correlated to higher injury rates. Whether it's in firefighters or the average population or assembly line workers or college football players, it's always correlated to higher injury rates. So taking into account that, but physiologically speaking, having a muscle that's pre-tensioned will have a lot easier time. Maybe you lose a little bit of the force from the momentum you can carry into that slack. But you do put your muscles in a position where you're gonna have a less chance of a strain because they're already starting to lengthen under that load. It's like taking a piece of putty and cold and just pulling it apart versus like gradually pulling and then pulling the last bit. You're gonna have a much easier time, not snapping it if you're gradually applying that force. And that's what you're talking about there. That kind of hit the tension and then they want to just yank through that.
Well, that's the part where like they're running.
Yes.
This guy's walking.
Right.
They're running full speed, and then that usually, that's like the boat anchor catches.
Yeah, and it's not. It just naturally, without being aware of it.
Yeah.
You're like right now we're teaching the academy, and I'm trying. No matter how many times I repeat it, of whether it's in front of you, whether it's up high, be able to see that loop because to them they think I care about their thumb being around it and securing it in their hand.
Yeah.
In all reality, the more important piece to me, and I don't know why, because I just you need this movement.
Yeah, absolutely.
So what happens is they start running. Now they're preloaded back here.
Yeah.
And then when it catches, there's no and there's an air pack on your back.
Mm-hmm.
So now there's restriction here, catching, and that's it.
Yeah.
So it's like, why would you do that to your shoulder or your pec? And that, even though it is preloaded, now we're running out of mobility.
Right. Yeah, absolutely. It's I mean, the catching the egg analogy applies to that just as well, right? If I'm in a place where I have no motion, no room to kind of absorb that force, I'm gonna have a lot harder time applying that force to the egg and not causing it to break. But if I have room behind me, I can gather that egg and put it in a position where it has a less chance of breaking, right? So same kind of situation where when you have the hand in front of you, not only do you have the ability to have room to move into and yield to those forces that are being applied pretty quickly, but you also have the ability to leverage the rest of your body to keep the hand in front of you instead of getting it yanked back, even if the force is pretty abrupt, right? Even getting to a position if the hand's in front of you, using your body as a stop as it comes back instead of immediately kind of going out to the side, right? So you have way more options, and options when it comes to movement is always a good thing. If you only have one way to do things, eventually you're going to have a situation where you either can't do that way or that position gets overloaded after doing it enough, right? Even say the best marathon runners in the world, they might start the marathon with like a heel strike, and then in the midway through they might be in a midfoot strike, and that's just to distribute forces throughout their body, so they're not using one aspect of their force absorbing capabilities the whole time, right? It's another example. Like if I'm sitting here in this chair and I had my elbow on this armrest the entire time at the same point, after an hour, it's going to be a little sore. But having options to be able to offload and move side to side is very important. And in that situation, having the options to absorb that force differently is going to be beneficial to anybody.
For sure. It's awesome. We're done with this one. I think that was it.
That's the rough part.
Yeah.
Yeah. Now the fun stuff. We're gonna get into the EMS side of things. These movements we do more frequently, being that that's 90-95% of what we do.
Yeah.
In this instance, the initial movement here, getting the patient from the lower point on the gurney to the upper, is something we don't do as often because the battery. We usually have the battery operation capabilities to raise it, but if we don't, we do have to do this. And this is also very similar to picking a patient up on a backboard.
So the first thing you see is them getting into a very deep squat, kind of pushing their weight on their toes. The one thing I do like is at least the arms are extended. So then that force application is straight through the legs. But we've seen other positions that the arms aren't extended, and then you're asking your arms and elbows to carry a load that you're thinking is going through your legs, right? So at least the arms are extended here. And then as they push to the ground to kind of lift, you'll see that they almost, as they lift, get into a deadlift position anyway. They're not staying completely upright. They actually lean forward as they're lifting. So when I see something like this, in my mind, I'm like, why are they not already deadlifting that off the ground? Why are they not hinging it more rather than trying to squat that position more? Because like we talked about, it's about the options, right? When I'm squatting, I only have the option to put my hands here and lift this up. When I'm hinging something, I have the option to grip different ways. I have the option to, put myself in a position where I can get more comfortable. I can go like a single leg, one leg forward, one leg back. If you're in a more cramped space, you have more options if you're training yourself to pick up things off the ground in more of a hinge position.
So when you're hinging, sorry, Clint, when you're hinging, what's the difference between the back position? Like what's the difference there?
Right. So the biggest difference is instead of your torso being completely upright like it is in that squat position, it's going to be more lean forward. And it's funny because incidentally, people have been taught that's a more dangerous position for your back. But watch there's a reason why most lifters can deadlift more than they can squat. It is a stronger position. We're utilizing the posterior chain, the hamstrings, the glutes, the adductors a lot more effectively versus a squat, especially the bottom part of a squat, starting it from in that paused position. That I would say the majority of people can't even get in that position comfortably. They have to be either up on their toes, and now they don't even have the whole foot in contact with the ground to apply force there. It's all going through their toes. So you're utilizing much stronger muscles when your body is a little more pitched forward. And at the end of the day, like we said, when he was getting up from that squat, he kind of pitched forward anyway. So why not just start in that position, be ready for that load rather than accidentally end up in that position is what I'm saying. So a normal squat, his torso angle would be the same as he lifts the whole way, right? But you'll see as he starts lifting here, his torso is going to lean forward, and then he's in a deadlift position anyway. So why not just start there and make it a deadlift? You know, like you'll never see a squat end like that, right? So that's my kind of opinion on that. I think that should have just been a deadlift hinge position from the beginning.
I think it's impressive that he walked into the deadlift. That was
I got pulled into the
how your body literally naturally found its way to like, no, let me tell you how to do this, person.
Exactly.
Well, I was gonna say, you see people in the gym and they start their deadlift like super low.
Yeah.
And then they explode until they get the tension on the bar, and then they're in their deadlift position that they would have started at with their ass higher and stuff, right?
Right.
And they're like, you should have just started there. And then you could have taken the slack out of the bar with your lats and been ready to lift the weight up.
Yes.
You know what? While we're talking about it, difference between, because we are discussing within the framework introducing the firefighter version of the new Army combat standard as our PT evaluation, and it's a hex bar deadlift. People that are unfamiliar will hear the word deadlift and go, no, not doing it. And
It's dangerous.
Like, well, wait a minute. You don't know. There's a reason why the Army is put so much 10 years and over $30 million, which I'm sure they're at 40 million now, into this. They wouldn't be doing it if it was dangerous. So first question would be, what is the difference between a standard straight bar deadlift as opposed to a hex bar with your hands by the side?
Right. So the biggest difference is just where the load is placed. So when you're the only reason why the bar's in front of you on a normal deadlift and not your hands aren't by your sides is because you physically can't do it, right? The bar runs into your shins. Ideally, any load you're lifting will be on near your center of gravity. And near kind of the center of your balance point. So what the hex bar deadlift does is you can stand in between the load and lift it up in that position. So what you're doing is you're able to take that load instead of in front of you, because we know the more the load gets in front of you, no matter what lift you're doing, the more stressors it puts on the backside. Right. So whether it's me doing a squat and like accidentally leaning over too far, or whether it's me doing a deadlift and the bar gets away from me, either way, I'm exponentially increasing the load on my body, even though the weight of the bar hasn't changed, but I've changed the amount of load because I've changed my levers. So what the hex bar deadlift does is it allows you to stand in the middle of this bar and not really change the load's application onto the person's body based on its position, because it's right in the middle.
And why does it reduce back injuries?
So it's hard to say that it really does. I don't think that's ever been like completely studied that it does reduce back injuries. The hex bar deadlift versus the barbell deadlift. Like I said, movement preparedness always trumps movement quality.
I'm sorry, not actually reduces it in real life, just safer, I guess, that there's less injuries with hex bar deadlifting than there is with straight bar.
Gotcha. So with that in mind, the biggest thing probably would be if you put 100 pounds on a normal bar and 100 pounds on a hex bar, the weight, the force applied to your body as you're making the lift is much more distributed throughout the lower extremities on a hex bar deadlift than it is during a straight bar. So straight bar, because of the position you have to get into and where the load is placed, will selectively put more of that force in your low back versus the other parts. Now, like I said, it's not inherently dangerous if you're prepared for it. But if a low back force related injury is of concern, then generally the hex bar will be quote unquote a safer option because it just offloads that place,
And it's probably maybe a little bit more of an organic position.
Yeah.
Than, like picking something up with your hands at your sides, probably a little bit more natural than leaning over in front of you and rubbing a bar against your shins.
Absolutely.
Right? So
absolutely.
That's kind of, I kind of feel like as the fire service progresses, maybe getting into like more strongman movements because they're odd.
Yeah.
Right. And it's really more organic. Like I've had medicine balls at my house forever. So watching my kids grow up, they instinctively picked it up.
100%.
Perfect.
Yeah.
Every time. Right.
Yeah.
And
those stones that they pick up in strongman, like how do they pick them up? With a rounded spine.
It literally
T-spine
crawls.
flex.
Right?
Yeah.
T-spine flex.
flexion.
And there's going to be some lumbar flexion in there too, but guess what? They're locked in that position. So it's not that the lumbar flexion is really a bad thing. There's not, they've done biomechanical studies on people that, have the really, really strong deadlifts or even look like they're in completely a quote unquote neutral straight spine. And there's lumbar flexion happening, right? So we shouldn't be scared of that position. We need to be good at that position.
Like what's that deadlift? Constantine,
what's his name?
Constantinople.
Yeah.
right?
Whatever his name is. Yeah.
His deadlift, he looks like a question mark.
Right.
But he's deadlifting like 900 something pounds.
Yeah.
I mean, he's a super strong deadlifter.
Absolutely.
So you going from powerlifting in high school, right, with your powerlifting coach, right into collegiate sports. When you started to do your strongman competitions and doing that stuff, did it take a second to translate for you, or did it make sense?
I mean, there's you got to learn how to pick stuff, right? And like I'm no pro strongman by any means, but like learning how to pick a sandbag or a stone or clean a log and all that stuff is, I mean, it's not the intensity of like learning an Olympic movement. Like learning a snatch, like an Olympic snatch, is an insane. It takes people 20 years before they get on a platform and do it 4 times.
Yeah.
You know what I mean? Like picking up a stone or a sandbag's way more organic.
Yeah.
I mean, there's not like a lot of form to it. It's like you got to figure out like where you position your feet and how you're going to lock your back in place and get down in that position.
Yeah.
And then go. It's not like learning an Olympic movement. That's what blows my mind about CrossFit. It's a little tangent. It's like they take these movements that, and I'm not against like high intensity interval training, right?
Mm-hmm.
But like having people come in to a gym and then giving them like a 5-minute class on like what a snatch or a clean and press is, or even like a thruster for that matter, right?
Yeah.
And being like, we're going to do these for time, right?
Wrap. Go.
Yeah. It takes people like literally 20 years of going through a meat grinder to figure out how to do this lift appropriately, and then they get an opportunity once every 4 years to get 6 lifts in.
Yeah.
You know what I mean? Like what a crazy amount of time you dedicate to a movement, like an odd movement pattern.
Right,
like
right.
I would never do a snatch
In real
of anything
life.
in my life.
Well, and that's why I was asking you if it translated pretty easy or naturally, because it seems like we've created more issues. Like in these videos, if the audio was on, you would hear in these 3 videos them go, be sure to lift with your legs, not your back.
Get up on your toes. Right?
Yeah, you hear it, and you hear it, and you hear it, and now it's almost like we've done it to ourselves, where you have people like sit and then they like just squat down as much as they can, grab whatever they can, and then stand. Where you're like, our bodies naturally want to find that home of that natural deadlift position instead of the squat position. So.
I think that's a big thing to kind of point out too. Is like is with the CrossFit movement too. It really, I think, almost took off too quickly, and they weren't able to really get the education out that they wanted to. And now the CrossFit movement's a lot better at making sure that everyone knows what they're doing and everything. So they've made humongous strides, which is awesome.
Well, the cool thing about CrossFit is it got everybody back into the barbell.
Yes,
like that
absolutely.
was a
Absolutely.
movement that needed to happen. Like,
Yes,
and honestly, I don't use a barbell for very much anymore. Like
a lot of kettlebells, medicine balls.
I use like a fat bar.
Yeah,
I use an axle for
gotcha.
most stuff. And but like it's just good that everybody came into like accepting the barbell again, which it kind of came out of favor there for a while.
That, and you can't hear the timer with headphones in.
Oh yeah,
that's kind of why my theory of why it took off is because the accountability. Workout starts at 7, and when that timer goes off, you better be ready.
Right.
And you can't have headphones in, so that way you can hear everyone else cheering you on and getting you to finish. The community aspect of it
created a very awesome competitive environment.
Yes.
Which I'm assuming that back before there were these Bluetooth headphones and everybody, wasn't walking around with the Walkman that was clipped, and that gym atmosphere used to be that way. And then the community aspect of it is, see what you did? You created this tangent. But yeah, I think that's another reason why it took off. But so now to the loading portion of the patient on the gurney. This happens regardless. The patient at the feet happen either way. So
the provider at the feet
is going to lift from that mid thigh pull, and be able to be that fulcrum for getting the patient up into back at the gurney or back in the ambulance.
Yeah.
So most of us now have an automatic. The battery-powered gurney retracts itself, but you're still holding a static position while the gurney retracts, and then you're not having somebody manually retract it.
No, I actually really like how he lifted that. Got into that hinge position that we talked about, made sure he gripped on the lower handles so his arms are more extended before the lift happened. And then if you bring it back to that part one more time, you'll see that as he's bringing his elbows up, and I don't know if this is on purpose or not, he doesn't just lift it like a bicep curl. He pulls his elbows back. So like that essentially uses his lats to pick up the patient more. So a bigger muscle he's putting his load on. So biomechanically, I actually like that quite a bit. Like I said, biomechanics aren't everything, but if you could do things efficiently, you'll be able to do them for longer without repercussions.
Well, this is part of something being organic, right? Because there's no way you're going to curl.
No.
Especially like an obese patient. Just out in front of you, right?
Yeah. Or even like if you're a smaller firefighter, like you're not going to be able to curl like heavier weights like that. So like I said, arms extended, great position, lifts up, and then elbows go back, not wrists up, was what helped lift that patient up.
So more of a 3-step method. It's not one solid movement. It's let's bend down, let's stand up with this with arms straight. Then once we're up off the ground, we'll retract, not curl.
Yeah, you're rowing that patient up. Even though a row is like a horizontal movement when you're moving in the gym, he rowed that and the patient moved upward. So like he uses biomechanics very well. So I actually, that's one video I think I can at least appreciate of the videos we watched so far.
Awesome.
And
now this contraption.
So stair chair.
Yeah.
This one, they are manually lifting the patient and bringing them down the stairs. There are newer versions that have an extension handle that comes kind of like a monkey bar that extends out of the top of it. That gives you a little more leverage and leans back on like a rubber track that'll allow it to roll down. Which isn't as dangerous, obviously, because you're not carrying the load. However, this happens in confined spaces all the time. There's never a wide open staircase that we can get the person down.
Right. Yeah. So the first thing you definitely notice is the person at the top is having a great time trying to get her knees to go through the back of the chair to go down the stairs naturally. And it's the same thing we kind of talked about with the deadlift with a straight bar versus hex bar, right? That load is always going to be in front of her because her knees can't go through the back of the chair. So it's always going to be in front of her. So that is going to selectively put more load on her low back. She needs to either be prepared for it or find a different way to do it. But, I know most of the times in these situations, there's not a different way to do it. You just have to do it. So at that point, if this is something that if you were preparing for this, say you had a competition that you want to be the world champion at being that person at the top of the stairs, I had a choice between making you hex bar deadlift versus straight bar deadlift. I would straight bar deadlift every single time. Because that's what's
in front of you.
Yes, because that's going to selectively, specifically adapt you for this better than the hex bar deadlift. People might look at the handles and say, "Oh, the handles are on the side, so that's like a hex bar deadlift." But look where the weight is; it's all in front. You need to be good and prepared for the weight to be in front of you and not around you. And that's what would make a straight bar deadlift more applicable to preparing for this than a hex bar.
And one thing I did want to discuss during this, and we haven't talked about, Clink mentioned it earlier as far as the magic with breathing. What is the importance and how do you breathe when properly? Because she knows the load's coming.
Yeah.
So that downward force of keeping your air in, can you explain that to our listeners? So
basically the steps in getting a great brace around the midsection to make sure you control the weight and the weight doesn't control you starts from getting in an efficient position, getting the rib cage kind of stacked over top of the pelvis. Now I'm not saying it needs to be in the exact place, this and that, but generally the rib cage being stacked over on top of the pelvis, a lot of people like to be in a very extended position because that's what they've been taught, chest up. And that puts you in a position where you selectively already started preloading your low back. I would say, 90% of the patients that I've seen that have low back pain with deadlifts do it because of overextension, not because of flexion that we've been all taught to avoid, right? I think maybe the pendulum swung too far in that direction. But yeah, getting the rib cage stacked over the top of the pelvis, getting some muscle activation. And then when you take that breath in, making sure that breath is getting to a place where you're breathing into some kind of tension. right? A lot of people take a breath first and then try to brace down. But at that point, a lot of the muscles you're trying to contract are like more stretched out. So you want to get in that brace position, hold the rib cage stacked over top of that pelvis, then take that breath in and almost feel like you're forcing air into tightness. That'll help you get a brace. Now, if that's not like a 1 rep max, then you can't afford to really hold your breath during this time. So it is a skill to be able to hold a brace while still breathing. But if it is a 1 rep max, then, or like you have to only lift it one time, then holding your breath is not a totally bad thing. The Valsalva maneuver in that case can increase the capabilities of you to gain strength and gain like a stiffness throughout the low back and throughout the area that can hold a heavier weight. But that's not going to happen if you're walking down multiple flights of stairs and you need to breathe, right? So at that point, just being in a good position, a more efficient position, I can't say good, a more efficient position is probably beneficial.
For sure.
And it's never 1 flight of stairs.
Yeah, almost. Yeah, I can imagine.
Never.
Yeah, and I'm thinking in the sense of this is obviously like 3 stairs when we get into those funky places, or if it's just when we're trying to get from tucked behind. I mean, it's tucked in the corner behind this king size mattress where the person collects Sports Illustrated for 45 years and there's no space anywhere. So you're having, whether it's one arm down or trying to hold on to something and leverage, and you got 4 or 5 people trying to get someone out of this realm of creating that, what you said, when someone's like, all right, because there's always one person usually at the head in charge and going, everybody good?
Right.
Ready? 1, 2, lift. And just teaching everyone to go, okay, I need to get my brace ready to get this person out of where they are. All righty. Move on. We got 2 more.
This is my favorite. This is the home run.
This is the total lifter.
And I even asked, how many years ago was this? And you were like 12. And I'm like, it's about right.
Looks the exact same?
This is like, I think I did my medic about 12 years ago.
Okay.
And that's the last time I remember seeing like how to properly lift a patient. It's like, get up on your toes.
Yeah. So it's very similar to the gurney video, but much worse because they put themselves in the position where, like we talked about, this, if you want to do it efficiently, should have been a hinge pattern, right? Should have been where, you can get that weight in a position where it's in front of you. You can get your arms extended. So you're placing the load, because they're saying there, make sure you lift with your legs. Okay, your legs are straightening, but a lot of that load is going straight through your bicep. And if someone gets heavier and like someone's not prepared for that, then you're putting yourselves in a position where, you're loading the bicep more than you thought you were. So starting in the hinge position where your arms are straight is going to be easier to get that patient off the ground. And then you can leverage, once you get closer to the gurney, bending your arms and rowing that patient up to get them on the gurney. So why put the smaller muscles under more load during times where you don't have to? Why not rely on the big muscles until you have to rely on the smaller muscles?
That, and like, if I'm going to lift something heavy, like I want my entire foot on the ground. I don't want to be on my toes.
Right.
You don't like this?
No.
I think that's awesome.
That should be before you leave the earth. That should be what your feet look like, not before you pick up an invalid, right?
Right. That's the big thing. It's like getting you in a stripper squat and then asking you to pick something up. It's just it's not the way to really efficiently do it. Like I said, I don't want to get into the mindset of like labeling something wrong or right, but there is more efficient and less efficient when you're taking in all the extra variables that firefighters have to go through to make sure they're being efficient physically. It becomes much more important when you look at the environment you guys put yourselves in.
Well, and Rhodes even mentioned it earlier. I mean, nobody falls down in the middle of a wide open spot.
No.
They're like stuck in between the toilets. So then you're like, you've got 1 foot on the tub, 1 foot on the tank.
Yeah.
You're like in some weird, like kind of one-armed, holding on for dear life. And then everybody's trying to contribute. So you very rarely are in a position like that.
Yeah.
And if you are, like what they did there at the end and like kind of linked around.
Yeah.
We usually pick straight up.
Yeah.
And then have somebody roll the bed lowered underneath it.
Yeah.
That way we don't have to move again, right?
Absolutely.
So, but sometimes you don't have that option.
Right.
Sometimes you have to wiggle through the Sports Illustrated and everything.
Right.
And as bad as this is, I think it's overlooked.
Mm-hmm.
Just in the fire service in general, it just is we utilize this piece of equipment, I would venture to say, every day at every station. And the assumption that everyone knows how to properly lift, or that we, for some reason, like he said, stairwells get really narrow. Doors are much smaller on EMS calls for some reason. It's a weird thing where we'll try to like let go. We'll have a full load, fine, scooting, shuffling, and then everything shrinks, and then now you're like trying to pass to the next person, and then then you hear your partner make this, and you're like, oh, what? Because now his load is going to me, and I'm like, this isn't good at all. But so that's just something.
And this has been so ingrained in us for so long that like I'll do the hinge to get down to. I'm not going to a squat to pick somebody up. So I'll hinge and I'll have people like tap me and be like, hey, buddy, you're gonna hurt yourself. And I'm like, I'll be all right, man. Thanks.
Thank you, though. Thank you for your concern.
Like the little girl, worry about yourself. What do you want me to do?
Worry about yourself.
So last video is a cardiac arrest with one of our auto pulse boards. This is what that usually looks like.
Yeah, when we watched this video earlier, this is the first time I'm seeing this, and this is like honestly one of the coolest things I've seen in a long time. How Klink was saying that, you know, now that they give them the compressions, it's actually better than just two hands, because you can do it while they're moving. You can do it while you can get the whole rib cage compressing back and forth instead of putting all that load on the sternum. That's why, I mean, that's one of the big reasons why you get cracked sternums and ribs in the area. You're putting all that force in one area. This distributes it better.
And it's perfect. It's no human error. There's nobody getting tired. There's nobody with bad form. There's nobody.
This is phenomenal.
Yeah, it's a pretty amazing. And I should probably know this, but I'm sure that it's increased cardiac survivability. But I don't know.
It would be interesting to look at the stats. Yeah, I think the other thing is like, you know, I know they have AEDs in a lot of buildings. Like, how far are we from getting this in the building?
Wow.
Right? Because you know, whether it's like, you know, waiting for one of you guys to show up or someone that is CPR certified jumping on there, maybe that's the only person, and they have to wait 7 minutes, and their arms are getting tired. They've never done this before.
I mean, the cool thing about this board too is there's pictures on it for us.
Yeah.
They show you like head goes here. You know what I mean? Like a green button is
Dummy
start.
proof. Yeah,
A
absolutely.
red button is stop.
Absolutely.
I mean, as long as it's charged.
Yeah. Why would you chance it? Why would you just assume this person knows exactly what's going on, especially in like a life-threatening situation? You know, there's a lot of adrenaline flowing. You could skip steps, but this is just like, you know, step by step by step. Here, make it dummy proof. Yeah. Let's get it on there.
Well, I'm sure these are expensive, and people won't get them until the insurance starts cutting breaks for them. Like I'm sure you get an insurance break with having so many AEDs per square foot per population. So.
And it can't cause any damage, because I mean, how many calls have you ran on where people are doing CPR and they shouldn't be?
Yeah.
You can hear the person going,
stop.
Yeah.
And you're like, hey, cut that out.
He's
and they
breathing.
But this is what them going down the staircase. Yeah. This is a good representation of what it looks like trying to manipulate someone going down and around.
Yeah.
It's just a bunch of weird angles. So
which is really interesting how they, you know, when they want to get into spaces like that, and how they kind of lower the legs in that position. It's similar to, you know, that gurney video we watched where he was rowing instead of curling, where, you know, it could be an interesting way to, instead of like having to lower yourself all the way down where now you're down here and putting more of that load throughout the lower back, like maybe picking that up and bending the knees from just pulling his knees towards his chest. And now you're still compact in this position instead of having to lower down and spreading out where your hands are in terms of holding the load, you're bringing them closer together. Oh. And when you're lifting a load, bringing the hands closer together is always going to be stronger than having to spread them across two hands further apart. That's the first thing I noticed. Yeah. I'm not sure if it's like, you know, impractical or, you know, the force on the straps, but I would think like you can almost keep your hands in almost the same position. If you you know, bend it a little bit, then you leverage and you pull it up towards it. So his knees are bent, but it's his knees up towards his chest rather than his feet dropping towards the ground. So that would be interesting. But yeah, I can see how, you know, this can just cause all sorts of issues where, like I said, it's a movement preparedness thing. And this is something that comes up so infrequently in people's training that it's hard to be prepared for this, especially when you're waking up, at 2 a.m. having to go do this somewhere at someone's house. It's dark. You're tripping over stuff. You didn't have enough sleep. Like a lot of these things can, invoke those, injury type reactions. Yeah. So,
even when you are prepared, it's not, that monitor itself, I think the monitor's 35 pounds.
Yeah.
The person, the board. Yeah. The average American, I think, is like 215 pounds or something like that now. Yeah. It's a lot of weight. Mm-hmm. So even being prepared.
Yeah. Well, think about that, right? If you put the averages, say just on like, even on the high end, say that full thing weighs 300 pounds, right? That's each person out of the four has to be able to carry 75 pounds downstairs, upstairs, in front of them, not around them. Again, so deadlift is going to prepare you for this a lot more than a hex bar deadlift is, and it's going to be asymmetrical off to one side. So like even like loading up a 75-pound barbell and carrying it like that could be a good way to prepare in that situation, So I think at the end of the day, you can't forget the SAID principle, the specificity of adaptations to impose demands. You're going to adapt based on the demands you put on your body, right? That's how we build calluses. That's how we build muscle, right? We have demands we put on our body that our body realizes, hey, I need to adapt to this to make sure this stressor isn't as big of a deal next time you do this, right? So if you can train with that barbell in front of you and like in the asymmetrical grip and carries in that situation, you're going to have firefighters that are more prepared for situations like this.
Cool. I think he just wrote PT for Monday.
There you go.
For the recruits.
There you go. You're welcome.
Well, awesome.
Yeah.
So we every episode, I don't know if you've seen them yet, we do a clip of the day.
Yeah.
We're just going to show a quick little clip.
Yeah.
And then you can give us your insight on it.
All right, let's see it.
Cool.
Yeah.
I'm going to let each one of you pick out the car of your choice. Sounds good, doesn't it? Pick it out, any color. You name it, it'll be tied up with a bow, and it'll be at your house tomorrow. And you say, well, what's the catch? And the catch is that it's the only car you're going to get in your lifetime. Now, what are you going to do knowing that that's the only car you're ever going to have and you love that car? You're going to take care of it like you cannot believe. Now, what I'd like to suggest, you're not going to get only one car in your lifetime, but you're going to get one body and one mind, and that's all you're going to get. And that body and mind feels terrific now, but it has to last you a lifetime.
Very wise words. I think applies to any situation, applies to any profession, applies to anything you do. I feel like the biggest shift that we've seen away from healthy lifestyle choices has been people are not really intentional anymore, right? They don't treat things as like fleeting and can be gone. They almost assume it's always going to be there. And when you're not intentional with your exercise, intentional with brushing your teeth, intentional with making your bed, intentional with these things, you get into a mindset that, hey, maybe I don't need this. And then eventually when your body tells you you need it, it's too late, right? And we live in the world of instant gratification. So when I post a picture, I get likes on it. When I take this pill, I immediately fall asleep, whatever it is, instead of really looking towards the root cause of why are these things happening in the first place. And usually situations you end up in physically are, if it wasn't like a trauma or anything like incidental, usually they're because of a collection of choices that you've made consciously. Right. So if you make every decision based on that, I think you're going to end up making better decisions. But it does take discipline. It does take, desire, and it does take a strong will to kind of, keep on to that.
How often does someone come to you just from word of mouth and go, hey, you fixed my buddy, and they go, and you go, well, how long has it been going on? You go, 10, 12 years. Does that happen a lot?
I'll say more often than not, because we're outside of the insurance world. We're direct pay, so really we're almost looked at as like the last resort. Like I've had people like, hey, if this didn't work, I was gonna chop my leg off, like kind of stuff. Like literally, I've had people say that, and or like if this didn't work, I was gonna retire, or like so it happens quite a bit. And it's, remember we talked about at the beginning of the episode, like the why, right? A lot of times people aren't going to make a change until the why is big enough. If they're having some pain here or there, they can muddle through some things. They can give up a couple of things that aren't super important, but when it gets to the point where they have to give up something very important to them, then they're like, I need help. Yeah. And I just want people to understand that, that could have been most likely changed with lifestyle changes earlier on. We never even had to make that decision. And all those little things you gave up, you probably never had to. Yeah. But it's tough because, like I said, we're fighting an uphill battle of instant gratification. Would I rather work out or rather go grab some ice cream?
Ice cream.
Yeah, every single time, right?
Still.
Right. So at the end of the day, like I'm not saying give up all these like quote unquote unhealthy habits. Like, a lot of those things cause you enjoyment and allow you to decompress and be human. But like, to be a human that can weather the storm, you have to put yourself through planned stressors.
And I would think that would be the key difference between professional athletes and tactical athletes is we are just stubborn and okay with, my shoulder's okay as long as I just don't have to reach above my head or do anything sideways or throw a ladder. I'm good. And you're like, what? Whereas like professional athletes have to perform and have to address those, I don't want to call them minor injuries, but you can't have any inabilities pop up.
It's also the emphasis that's been put on professional athletes is to be in peak 100% performance, where tactical athletes haven't been provided that infrastructure or resources. And so now they're like, well, I can live with this.
Yeah, it's good enough.
I'm going to eat a bunch of ibuprofen and then drink myself to sleep at night. And you're like, that's not how you should be living your life. Right. You should be 100% functional, like into retirement. Yeah. But they don't look at it. And even like professional athletes kind of fall off too after they're done with that being their job and their mission is human performance. And then they get into like retirement. And then they become announcers, whatever they get into, right? They own a dealership, whatever they do. They seem to slip too because the emphasis on being 100% leaves and fleets. Yeah. And that shouldn't be the case with age. I want to be like that weird looking Santa Claus that's ripped. You know what I'm talking about?
Right.
You know what I mean? Like just white beard and yoked. That's what. And
just veins everywhere.
Just die like that.
Yeah.
But in that, I mean, the clip saying you only get one body. I mean, we haven't discussed it, but when you're not injured or something's not bothering you, I'm assuming that you still go to optimize.
Yeah. Oh yeah. Yeah. And there's things that, and like you were touching on with the instant gratification, like the world's, and this is going to sound bad, the world's too easy right now.
Yeah.
Like I get mad when I order something off of Amazon and it's not at my house the next day.
Right.
You know what I mean? It should be.
Yeah.
If it says at 5 o'clock to 10 o'clock at night and it's 10:01, Amazon has failed me. You know what I mean? And that's ridiculous.
Right.
That's so we don't have enough tough things. And like, this is another little tangent. That's why I like you said, inducing stressors. Like I like fasting because it's uncomfortable. Like, I don't know what
you
kind of.
Sure, you did it pretty easily.
It's still uncomfortable.
Yeah.
Cold showers, uncomfortable. Like I do it because like I want, the world's way too easy. You know what I mean? Like we have more than anybody in history has ever had. And then we expect, and then what's funny is like you would think that's like the money leads to happiness fall, right? Like you think the more money you make, the more happier you're going to be. I think P. Diddy said that, right?
Yeah, something like
it's
that.
more money, more problems,
more money,
right?
more
For
problems.
sure.
Yep.
Because like you just expect it and it's easy and it's not as earned. Like the first car, if you're given your first car versus if you bought your first car, you would take care of that car.
Yeah.
That was you worked for, the one that you were given. You're just like, nah.
Yeah, and even him, I think that's the purpose behind this is he still drove, and I don't know obviously if he still does it, but it was a big thing about Warren Buffett for a long time was that he drove the same whatever it was, Camry or something.
He lives in a really modest house, and he's worth billions of dollars, and he lives in the super modest house. He doesn't spend a ton of money, and I think at the end of the day, that could solve a lot of issues in people's lives when it comes to finances. Like just because you make more income doesn't mean you have to spend more income. Doesn't mean, of course, if you're underneath a certain level, like when you make more income, you have to shore up necessities. But I think people want to buy more things to impress people that they don't even like really talk to or so like I said, it applies to so many different situations. Like Clint was saying about the applying the stressors. We've gotten to a point where stressors are going to be inevitable, right? But we want to live our whole life without stressors. So then how are you going to be prepared for them when the stressors do come on, right? Like, if we be as specific as firefighting, right? The reason why you lift specifically in your program is to induce the stress that you're going to, put on your body out on the field. So the more specifically you can, impose those demands, the more specifically you're going to adapt. So it's the body's adaptable, resilient, phenomenal tool for us to carry throughout our whole lives. It's just we take it for granted because our lives are pretty long, right? We're average is going to be around 78, 80 years old as we kind of go along. So over those 80 years, it's easy to forget that, hey, this is my only one I have.
Yeah, for sure. Well, cool.
Yeah.
Thank you.
Of course.
Dude, Zaki, you are one of the pillars of the firefighter framework. You have thrown more time and resources at the fire departments here locally, and hopefully getting some stuff out there on a broader level with this. But you've been invaluable to us, man. We can't thank you enough for
Appreciate that
what
so
you've
much.
done and coming on today. But like literally all the time and headache that you've endured with us, man. I thank you so much.
Of course, man.
Yeah.
Anytime. Glad to do it.
Alrighty, awesome. Thank you again, everybody. That's it. Well, sort of. That's 10 episodes. So our next one will be a little recap, a little see you later episode. We'll recap the 10. Maybe touch on some things that we wanted to dive deeper into in those 10 episodes. But other than that, this has been awesome, and we'll see you guys next time.